How do you identify basal cell carcinoma, BCC? Imagine noticing a new bump or patch on your skin that just doesn't seem to go away. That's often how basal cell carcinoma begins. To identify it, doctors start with a careful physical exam, looking closely at any suspicious spots. They check for lesions that are shiny, waxy, or translucent, often on areas most exposed to the sun like the face, ears, or neck. These bumps may look like small pearls or have a waxy appearance. Sometimes they have tiny blood vessels visible on the surface, called arborizing vessels, which are a key sign of basal cell carcinoma. The lesion might also develop a crust or ulcer, especially if it's been there for a while. Dermoscopy is a helpful tool that magnifies the skin and highlights specific features of BCC. Under this device, doctors look for characteristic signs like well-focused blood vessels, blue-gray globules, leaf-like structures, or ovoid nests. Pigmented basal cell carcinomas can look darker but usually do not have the pigment network seen in melanoma. Recognizing these features helps clinicians decide if a biopsy is needed. A biopsy is the next step and is essential for confirming the diagnosis. During this procedure, a small sample of the suspicious lesion is taken using methods like shave, punch, or excisional biopsy. The sample is then examined under a microscope by a pathologist to look for basal cells that have turned cancerous. This step not only confirms the presence of basal cell carcinoma but also helps determine its subtype and how deep it has invaded, which guides treatment options. In recent years, advanced tools like reflectance, confocal microscopy, and fluorescence imaging have been developed. These can sometimes help visualize the tumor more clearly and define its edges, but they are usually used alongside biopsy rather than replacing it. Because basal cell carcinoma can recur or new ones can develop, regular follow-up skin exams are important. People who have had one BCC are at higher risk for others, so ongoing monitoring helps catch any new or returning lesions early. In summary, identifying basal cell carcinoma involves noticing the characteristic shiny, translucent bumps or patches, examining them with dermoscopy for specific features, and confirming the diagnosis through a biopsy. Early detection is key to effective treatment and maintaining healthy skin. Always consult a healthcare professional if you notice any unusual skin changes, and remember that individual cases can vary. Proper diagnosis and personalized care are essential for skin health.